Hey, I'm Liamith,
My name is Jay, and welcome to the Medical Frontier podcast.
where we talk about today's inventions which are tomorrow's standard of care. Today, we will be deep diving into the future of neurodegenerative diseases and particularly Alzheimer's disease.
Yeah, so we found this interesting. We actually looked into an article that talked about how there's different cures for medical diseases such as Alzheimer's that they have been coming up with, and we came across something specific called Leqembi.
Yeah, so what Leqembi does is it targets the amyloid protein, the amyloid plaque buildup. And what that amyloid plaque buildup does is it inhibits the brain cell's ability to communicate with each other and kind of clogs up the brain, if you will.
Yeah, so we found that the beta amyloid 42, which is the most toxic form of this buildup, is located mostly in the gray matter area of the brain, which is located on the outer parts of the brain and is made up of the axons. And so what happens is, or what we theorized was that these clumps form together based on the polarity of what is made up in those beta amyloid 42 proteins. And we were comparing this with how tau affects Alzheimer's as well.
Yeah, so there's two types of proteins in this scenario in neurodegenerative diseases that we've been seeing. It's the amyloid plaque buildups and the protein tau. Now, when looking at CTE, amyloid plaque buildups were only found in 50% of those who had CTE. So the tau protein is more prevalent and has a bigger effect in those with CTE, whereas with Alzheimer's, the amyloid plaque buildup is the main cause of the symptoms of memory loss and just various cognitive deficiency from a variety of standpoints. And we just wanted to talk about this, get you guys in the loop. This is our first episode. We're very excited to have you guys here listening to our
Super
podcast.
excited. Yeah.
And we just wanted to chill back, have a casual little conversation back and forth about this advancement in neuroscience and what could it mean for not only Alzheimer's but CTE as well. There's a lot unknown about these two diseases, a cure for neither, a diagnosis pre-mortem only for one. So there's a lot to unpack here. Um,
Wow.
so
Yeah, so Liam, it's seeing that we both are interested in things to do with sports, basketball, football. How did you get interested into looking more into CTE and how Alzheimer's, because we know Alzheimer's is like,
mhm.
it slows down cognitive function and things like that. How did you become interested in looking into the effects of CTE?
Yeah, so in middle school, I had a project to write an essay and searched up head trauma. This is about roughly, I would say 2015, 2016, right when CTE was picking up. And I just came across it, and there was nothing on it. It was just that it gets caused because of repetitive head impacts. That was about it. And there was a protein tau, and I was focused on CTE a lot throughout my middle school and high school career. Recently, I was able to realize that Alzheimer's also has the same protein, and so I kind of transitioned and I'm focusing on both and rather than just CTE. And I think it's very interesting to see how this advancement, what it could mean for not only Alzheimer's, but what if it could prevent CTE symptoms as well, and what if these people respond to this drug with CTE? So what does that? Could we diagnose people premortem that way in a sense, if knowing that these amyloid plaque buildups would be relieved if we gave them this medication,
Right.
because it's also prevalent in those who have CTE.
Mm-hmm. Yeah, and it's interesting because we found that Leqembi, I think we saw in the article that it was approved by the FDA in July of 2023, so less than a year ago actually. And the way
Mhm.
I got interested into looking about this topic was because I saw a couple of ads, since I'm interested in basketball. I saw a couple of ads about some students doing like an Alzheimer's classic, like they form teams and they do like a pickup game. They do tournaments and stuff like that to bring more awareness and money into Alzheimer's research and things like that for creating cures like Leqembi. And so, looking into Leqembi, we saw that since it was approved in 2023, there's a lot more medications like Leqembi, but Leqembi is the first one that was FDA approved. And in a clinical trial, it showed that 30%, there was more than 30% of the beta amyloid plaque buildup, and it reduced it by 30% instead of the placebo trial.
Yeah. So it inherently doesn't have too much of an effect, but rather what it does is buy time for those who have Alzheimer's for the disease to not completely overtake their lives and these caretakers to be so dependent and have to have so many resources for this person to live. And essentially, no matter how much medication they take, all that it's doing is removing the plaque buildup, as Jai said.
Mm-hmm.
Um, so when we have this plaque buildup that we remove, it's gonna keep coming back because it's caused by the misfolding of proteins, and that's not something that we can change. All we're changing is the effect of those misfolding of proteins and that clog that it's causing. We just keep removing as much as we can through the microglia of that this drug causes to go ahead and target the amyloid protein, like that's inhibiting the brain cells to communicate.
Yeah, and it's cool that like there's two different, right, Liamith, that we saw. Not only does it remove those buildups, it also strengthens the microglia's ability, which is kind of like the immune system of the nervous system. And so I thought it was cool that not only did it try to target those buildups, but it also strengthened the already existing microglia. And
Mm-hmm.
I don't know personally anyone that suffered through Alzheimer's. Liamith, do you know anyone?
No, I don't. The only thing similar that I've really read about or heard about is CTE and the socio-cultural effects of that from a
Mm-hmm.
standpoint of a caretaker's perspective, and just how much of a toll it can take on people to take care of somebody else and see their loved ones going through that. I think that this drug is really revolutionizing medicine in a way that it's easing people's lives in more ways than one. Not only is affecting the participant who's taking that medication, but also those around them who don't have to witness that rapid decline as much. Obviously, it would be great if we could remove that at all in total,
Mm-hmm.
but unfortunately, we're not at a point where we can do that yet. And the interesting thing is going back to the amyloid beta plaques and the tau protein. So the amyloid beta plaques is not limited to those with head trauma at all. As we've seen in Alzheimer's, those who have Alzheimer's are not exposed to head trauma all the time. That's not a, it's a case by case status. And so amyloid beta plaques, they can develop at a younger age in people even without head injuries. So that's where there's a difference, right? Because in those with head injuries, the protein tau is more prevalent and causing them to have all these neurodegenerative symptoms and stuff like that. But those who are without it are still having those same symptoms, but because of amyloid beta plaques forming, not because of that tau protein. Because those with CTE, only 50%. 50% is not a large margin at
Yeah,
all.
that's really interesting too, because if you think about CTE, it's basically like the same symptoms, right, of those neurodegenerative disorders like, memory loss and other types of like, not remembering clearly or how not being able to go about your day-to-day lives like you normally do and things like that. But it's interesting that, 50% isn't a large chunk, like you said.
Yeah, and I'm trying to look into what causes the amyloid plaque buildup, and it's saying that cholesterol buildup increases amyloid beta production, and in turn fuels plaque accumulation.
Mm-hmm.
So there's a lot of different factors here that can go into Alzheimer's developing,
Right.
and it's it's more a prospective scenario in a case by case status. And also doctors are also saying that CTE could potentially cause Alzheimer's down the line. So if we don't, because we currently have no way of diagnosing CTE until post-mortem, right?
Mhm.
So if we don't know that, say this 30-year-old has CTE from playing, let's say, 8 years in the NFL, and then later down the line, they develop Alzheimer's by the age of 40 or 50, just because they had CTE earlier. But nobody knows. Like, there's just so much uncertainty and so much that we don't know about everything that it's really, really interesting to see.
Exactly. And then another thing that I found interesting was that looking into how people can be treated using Leqembi, it seems that they can use IVs or it can be taken subcutaneously. And that's really convenient because we've been using IVs for such a long time that, it's not too hard of a method to use.
Mm-hmm.
And given how much of a breakthrough this drug is, seeing that it can be used so effectively and so conveniently is a really big thing. And then going back to what you were saying about how you don't personally know anyone, but seeing how they can go through. I remembered my neuroscience professor talking about how his mother suffers from Alzheimer's, and like how he remembers that sometimes she has trouble remembering who he is, or sometimes there's trouble like for her going about day-to-day life tasks. And like when someone you love is going through that, and someone's so close to you, like your mother's going through that, how much of an effect that can have on not only their lives but also your life, and how Leqembi is doing everything it can to slow down that process is a really big thing. And the 30% that I mentioned of the 30% of the amyloid buildup, that's a pretty big percentage too. That's almost half, but 30%, like anything you can do to slow down, because slowing down something like this is a huge challenge on its own. So 30% is really a significant mark in
Yeah,
slowing down Alzheimer's.
yeah, I completely agree with you. I think Alzheimer's is definitely a really scary disease, and it's hard to see somebody go through that. And yeah, it's cool to see how this new medication can change things for the future of Alzheimer's.
Mm-hmm.
Um, Going back to the correlation between Alzheimer's and CTE, I just came across an article from Indiana University that the misfolding of the abnormal protein tau in CTE is different than the misfolding of the protein tau in Alzheimer's. So again, there's just so much that we don't know, and like this such small things that could have a huge role on it, right? Maybe this protein of tau would work for Alzheimer's if we're able to identify it. This protein of CTE we're not able to identify it. There's just so much that we don't know, and it's it's it says what they determined is that the fold of the abnormal tau protein in CTE is different from the tau fold in Alzheimer's disease. And so they
Mm-hmm.
did this by using an American football player and two professional boxers, all who were recognized from suffering from CTE, using cryogenic electron microscopy. Um, so yeah, this is definitely just one of the many studies that are now coming out in the past 10 years or so, since the NFL didn't associate CTE with football until 2015. And we
Right.
have been knowing about punch drunk syndrome since the 1920s.
Mm-hmm.
And, people only started talking about CTE when Dr. Bennett Omalu found it in the football player, um, Michael. It's not. Oh my god, I forgot his name.
Yeah.
But regardless, yeah, since he found that in 2001 or 2, I think. Then people still didn't give him the time of day. He was turned away, and it's it was ignored for so long
Mm-hmm.
that it's not getting the attention that it deserves until recently. And still then, there's still some limitations. Like, even with multiple research organizations that are partnered with these NFL teams, they are not allowed to do research on CTE at their centers,
Mm-hmm.
just because of how controversial it is. Even though it's scientifically proven, just because people don't want to take away from a $1 million billion industry in the NFL, and
Yeah.
drive it away and put something negative towards it.
Mm-hmm.
And it
Yeah,
just
that's a
sucks that.
huge concern, right? Because at one point you have to consider like the health of the players, but you also have to consider like, like football is a huge form of entertainment, especially in the United States. And if you put like a negative connotation on it, what are people that enjoy and love the sport gonna do? Like, what are they, like it's gonna definitely bring down viewership by a lot, or definitely change the structure of the sport.
Yeah, I think
Hmm.
it's definitely something that really needs more attention, and we need more people to work towards
Yeah.
recognizing CTE and recognizing that it's a really big issue. And in fact, there was just a, I think, 10 or 9 year study done by Boston University. Let me find it. I think it's called the Diagnose Hope study,
Hmm.
if I'm not wrong. Or maybe it's Diagnose.
Liam, if you were mentioning the cholesterol, right? That has to do
Mhm.
with how the plaques build up.
Yeah.
Yeah, it's
Yeah.
interesting because the actual reason why beta amyloid 42, which is the most toxic form of this buildup, the reason why it's the most toxic is because of, how it can, leak ions into the surrounding areas. And if we look into like how neurons work, which are the main controlling factor of how we go about our day to day lives in terms of walking, thinking, any movement we can think of, or anything that we do, the leakage of ions is very very detrimental because the way the neurons work is through the movement of ions. That's basically what an electrical charge is, the movement of ions. And if we talk about like how the ions leak out of where they're supposed to be, we also get into like um, detriment to how like the mechanically gated voltage channels work, like the calcium channel, the sodium channel, the potassium pump, and all of that. So, that's I find it interesting that that's how it actually attacks, um, and how Alzheimer's is brought upon when you have the beta amyloid 42 protein.
Yeah. Yeah, I think it's interesting to see the intricacies of things and how things form. And again, just going back to the correlation between CT and Alzheimer's in terms of like unknown, there's repetitive head impacts that cause, I think it's, I think I'm 90% sure it's white matter.
Mm-hmm.
And so what that does is it has the exact same effects as the tau protein, the
Mm-hmm.
exact same effects as CTE, but it's not. And it has the same cause, but it's not. So there comes a point, how are we supposed to differentiate between the two? Like it's very very difficult to do so. And there is a study that is being done. I don't know if it has been completed yet, but it's the first research project on CTE that was ever funded by the National Institutes of Health. And the goal of the study was to develop methods of diagnosing CTE during life through MRI scans, MRS scans, blood tests, and measures of proteins in spinal fluid. And now the spinal fluid aspect is interesting because if you look at Alzheimer's, the way that they diagnose is because of the spinal fluid. So that from the brain, how the spinal fluid can have a biomarker that scientists can say, okay, you have this. Like, that is a very, very interesting advancement. And I think that there's going to be more research into that. And I personally was also so interested in finding a way to diagnose, CTE pre-mortem. So I looked into how people can be completely diagnosed with Alzheimer's, but why can't they do it for CTE? The proteins are the same. I was very oblivious to the fact that the proteins are not entirely the same, and that the protein tau is folded differently in this and that, and amyloid plaque is more common in this and then that. And it's like, what is causing that difference, but what is it causing to like be so similar? Like
Mm-hmm.
there has to be some sort of correlation of the cause, that like the repetitive head impacts cause this, and the Alzheimer's disease patients have this pre-existing condition, Because there's no way that there is not a correlation with so many similarities on so many different levels, but with two completely different causes. Like
Exactly. Yeah.
that's very, very interesting. And maybe if those who don't have head trauma at all throughout their life, like, do those people also get CTE? People who haven't played football a day in their life, like, um, there's so much. Sorry, I slipped up. I meant Alzheimer's, not CTE. But
Mm.
those who haven't played and had any head trauma, do those people get Alzheimer's? Do people who have played football only get like Alzheimer's? Do people who play football not get Alzheimer's? Like,
Yeah,
it's
it's a
there's so
lot of.
much to unpack, and I think there's going to be years and years of research to go into this until we find a true diagnosis for CTE. And the day that that happens, that will be a revolutionary aspect in medicine, and I hope they don't go missing. I really
Mhm.
hope they don't go missing,
For sure, for sure.
because that's happened a lot to people,
Yeah.
unfortunately.
And when you were talking about like how like if you're looking into like a similarity between the amyloid buildups and the tau tangles, I actually came across this cool analogy. Yeah, it says that the amyloid beta and the tau tangles could be looked in as like a trigger and bullet type of analysis. And it says that while the amyloid hypothesis indicates that tau aggregation happens downstream of amyloid beta aggregation, tau tangles can be seen in the brains of patients with no amyloid beta pathology and very mild dementia. So similar to what you were saying. So even without the amyloid beta, there's still tau proteins that are tangled in the brain in the gray matter region. So it I came down across and found the trigger and bullet hypothesis, and I would think that, let me know what you think about this too. But I would think that tau would be the trigger, and then the amyloid beta would be the bullet, because it stated that even with none of the amyloid beta, there's still tau in the brain, which can cause those neurodegenerative symptoms to form, especially when tangled.
So you're saying that tau being present causes amyloid, or it doesn't cause it?
That's what we don't know, but we can see that when there's tau there may not be the amyloid beta,
Right.
or there may be the amyloid beta, but there's
Right.
no research, or people are probably working on research as to finding out what the relationship between those two is.
Let me see something. It's funny that you bring that up. My idea and what I'm thinking is that the presence of amyloid beta plaques um could cause, wait, that didn't make sense. Hold on. Because tau proteins are there without the amyloid buildup.
That's what it says. And then also found that some researchers have found that the amyloid beta clusters appear first, and then the
That's what
surge of that causes like an increase in the levels of abnormal tau, which then has like a negative loop in terms of like when there's more of the tau, it forms more of the amyloid beta and whatnot. So it's more
Okay.
like a
I
feedback loop. Once there's more of one thing, it just forms more of the other, and that causes more of this, and it
Okay.
just keeps going on and on.
So I think that the amyloid protein being present has to have the protein tau, but the protein tau can be present without it. Like the
Yeah.
amyloid plaque buildup,
Mhm.
when that happens, there's more than likely tau proteins as well.
Right.
However, when there's a tau protein like misfolding, there's
Mhm.
not always amyloid plaque buildup.
Yeah.
I
So it'd
think
be interesting to see like what disorders, like if most of the neurodegenerative disorders, not just Alzheimer's, it'd be interesting to see if most of them are caused by only tau, or only of the amyloid beta, or even an inclusion of both, or to see if like the presence of one has to cause the presence of the other or whatnot as well.
yeah. Yeah, I think I'm the way that I'm creating this analogy in my head is a square and a rectangle. So
Oh,
the amyloid proteins, a square can be a rectangle, but the tau
mhm.
protein can't be the cause of the amyloid,
Right.
right? Because
Right.
the tau protein has been present when amyloid has only been there 50% of the times, right?
Mhm.
So let me look into seeing if the tau protein is present.
Yeah.
Okay. So I think what you said is correct because two-thirds. Okay, so tau protein levels are increasing in about two-thirds of patients with probable Alzheimer's disease,
Hmm.
and in half with those with possible Alzheimer's disease.
Right.
And tau levels are also higher in patients with Alzheimer's disease than in amyloid beta negative patients.
Hmm. So
So,
Liam, you yes, but what were you saying? Continue.
yeah, so what I was saying was right, but not on a definitive aspect, I think. So what you said, they kind of feed off of each other,
Hmm.
and they're related to each other,
Right.
which is pretty cool to know.
Hmm. Yeah, and do you have information on like how CTE is diagnosed? You said it's, I know that you said it's postmortem, but do you know how they actually find out whether it is CTE? Because I see that the way that amyloid plaques are detected is through the PET scan, which is a form of neuroimaging. So is CTE also detected in a similar fashion, like a PET scan, or do they use like fMRI or MRI or other technologies like that?
Okay, they so usually for CTE, from what I know, they always do an autopsy to
Hmm.
diagnose it, and I think they. Okay, so it says they take a histochemical and immunohistochemical analysis of the brain to
Right.
identify the presence of neurofibrillary tangles and neuritic threads.
Hmm.
So they look for evidence of damage to the brain, such as degeneration of the brain tissue and deposits of tau and other proteins in the brain.
Right.
In the depths of the brain's valleys, known as sulci, pathologists often see changes linked to CTE. In
Hmm.
this region, pathologists can identify clumps of a brain protein called phospho-tau, which points to an injury having occurred there. Okay, so now the reason why they can associate it, even when they see the protein tau in the autopsy, is because that they see clumps of a brain protein that point to an injury and brain damage from external forces, which is why they can confirm that it's CTE and it's nothing else. And there is no way, you were asking about the scans, there's
Right.
no known way to use MRI, CT, PET, or SPECT or other brain imaging methods to definitively diagnose CTE.
Hmm.
And there's obviously no blood or spinal fluid test for CTE.
Hmm.
Um, but so you were saying that for Alzheimer's it was scans.
Yeah, they use PET scans to detect those the plaque buildup, the amyloid beta plaque buildup. They use
Mm.
the scans to determine like where and how much of the buildup there is in the brain and exactly what regions. And it shouldn't be too difficult because it's mostly found in the gray matter areas, which are in the outer parts of the brain. So they first find that, and then they decide how much of the Leqembi to use for IV or subcutaneously, like what amount to use and whatnot based off of that.
Okay, okay. So it's
Yeah,
kind of like a assessment, if you will, of
exactly.
the location of the proteins and
Exactly.
how much to provide with the medication.
Hmm.
Okay, that's good to know. That's very interesting. I
Hmm.
think we had a very great conversation here today. Um, I think definitely we're gonna continue this. We're gonna continue to come out with more topics to you guys. This topic, I would say, we're both neuroscience majors. Just wanted to get that out of the way, so we kind of have some interest in what we're talking about with this first topic, and we kind of have some background. But
Hmm.
we're gonna try and do some research about some other advancements that could potentially be more interesting tell you guys about, and just to have conversations, just to talk about what could potentially happen in the future regarding these medications, regarding these advancements, and how can that affect similar diseases or similar, um, just similar patients, as I said, like just with similar diseases and stuff like that. So yeah, I think this was very, very, very good first inaugural episode.
Very
I'm
good. Hmm.
I'm very, very excited to see what else we talk about and to have you guys on this journey with us.
For sure. One last thing that I saw was some anecdotes on people who have received like a trial version of the Leqembi.
Mhm.
One patient said that the treatment has given her hope that she can actually read and sit back in a chair with her dog for a couple of hours, which I found really wholesome. And then another was
Yeah.
that two patients with mild cognitive impairment says that the drug has given them their entire life back, which just
Wow.
goes on to show how like imperative this drug is and how useful it is in treating patients that undergo Alzheimer's and different neurodegenerative diseases. But yeah, I think this was a very, very interesting topic to go into for this first episode. Yeah, like Liam has said, we're really excited to further go on this journey with you guys and discovering like the new breakthroughs in medicine and what's going on in the medical field. And we really hope to engage with you all even more and see you in further episodes.
Thank you, everyone. Bye bye.
Thank you all so much, and hope you all have a great day.